Hey everybody, it's Dr. Paul Thomas with Startup DPC. Thanks so much for watching this episode. I have a very special guest, student doctor John Zakhary from Touro Medical School in Upstate New York. And he's a medical student. Medical students have questions about this model. We're going to try to go through as many of them as we possibly can in this episode. So welcome to the program, John. Thanks so much for coming on today.
Dr. Thomas, thank you so much for having me and taking the time to answer some of my questions.
Hey man, you're welcome. So I'm going to cue everybody in on a little background. John actually came through in early January 2020, hung out at our office for like a day and saw how our practice worked, saw how everything flowed through our office. So he got a lot of these questions answered. So we're going to do a little recap and some new stuff. So dude, thanks for coming through. Detroit, Michigan, checking out our office.
Yeah, my pleasure. So I just wanted to jump in and start, and correct me if I'm wrong. I think one of the big issues with primary care is it's not incentivized enough for providers, and it's not that accessible for patients. So I guess my first question is really, how does direct primary care make healthcare more accessible for the patients? And what problems in American healthcare do you think that this delivery model is addressing?
Yeah, I think to start with, there are a lot of people who fall into the gaps of coverage. And for our practice in Detroit specifically, there are a lot of people in Michigan who earn out of Medicaid coverage. So if you make $17,000 or more, you disqualify yourself from Medicaid in Michigan. And that's a lot of people who are in the service industry, like hairdressers, truck drivers, bartenders, restaurant workers, etc. There's a huge portion of our population, and it's actually 28 million Americans are uninsured currently. So, everywhere in the United States, you're going to find folks who are uninsured, but then there's also folks who are underinsured. Perhaps if you're making $50,000 a year, you might purchase a high or low premium, high deductible health insurance plan or a catastrophic coverage plan that doesn't really afford you great primary care access. So that's where direct primary care can come and be very impactful, is we can start providing that basic bread and butter primary care access and really give people a great healthcare experience while we're at it.
Right. So obviously it seems like there's a financial incentive for patients, but how would you describe the value that your office offers to patients that they really couldn't get elsewhere?
Yeah, I think, if you're an uninsured patient, a lot of times you go to the emergency department because, quote unquote, it's free. Or if you're underinsured, let's say you have a Medicaid plan, you go to the emergency department because it's free or whatever, or an urgent care because it's low cost. But you really don't get that consistency of having a solid primary care physician who can be your advocate and can guide you through difficult problems that you might be facing. Like a chronic condition like high blood pressure or diabetes, some of the most common concerns that we have, or something like chronic back pain, a physician who can guide you through managing that without opiates. Whereas you might see somebody in the emergency department and just to get you out of there, they might give you 5 or 10 Norco or something.
Sure.
So it's like that continuity piece and having somebody who actually cares for you and wants to help you with your concerns.
Right.
And I think in other environments like an emergency department or a really high volume primary care office or really high volume urgent care, the incentives aren't there to build relationships. It's more about getting the work done for the patient in the immediate term and then getting them out the door quickly so you can see the next person.
Exactly. And so obviously one of the greatest values that you offer to your patients is the amount of time that you're able to spend with them. So how does that work? How much time do you spend with patients, and what can you do with your patients with that time that maybe other providers aren't able to do?
Sure. Yeah, I think it starts off by saying that a typical family physician is going to have 2,400 patients, or 2,400 patients is the average.
Sure.
That's across the board for any family physician or internist or pediatrician. You just have to see 24-ish patients a day or 1% of your panel each day to make enough money to keep the lights on, pay your staff, pay for your overhead, your rent, your lease, etc. In our model, we can cut our panel size down to about 500 patients. And so now when we see 1% of our panel each day, we're seeing about 5 patients a day. And that means we can spend 30 minutes to an hour with each patient rather than 15 minutes or 20 minutes in the insurance-based system.
Sure.
Plus our charting system or electronic medical record system, you saw when you were here, it's pretty streamlined. It takes us 5 minutes to write a comprehensive note, where in the let's say the next gens or the what is that one called? What's the big EMR that you use at your hospital?
Epic is one of the big
Epic,
ones.
Yeah, that's the one I was looking for. Epic or Cerner, there's a lot of box checking, and it's pretty clunky, and it takes a long time just to write a basic primary care note.
Right.
And then to build that out, it takes longer. And then it has to go to a biller and a coder to make sure you're getting that reimbursement. Then you get paid 90 days later. There's all these problems baked into our current system for primary care. And direct primary care resolves a lot of those challenges.
Right. So I think one of the things that decentivizes medical students from going into family med or a primary care field is that they don't really feel like they can really accomplish much with their patients, perhaps, or they really want to see some more complicated stuff. But I'd say when I was shadowing you, I was fascinated by all of the resources that you had that made your job easier and that enabled you to handle some heavier cases or some things that normally you would refer for. So could you speak a little bit to just some of the resources that you use and how it makes your job easier?
Yeah, I mean, I think you were there when we had a patient with depression, and I just pulled up like a Beck's depression inventory that I have as a Google form, and they put in their unique medical record number, like let's say 150, and then they answer that questionnaire in the office, paperless. I review it, and we compare it to their last visit. We refill their sertraline in office, 50 milligrams. It's 2.5 cents a pill, 3 cents a pill. So then they have their 60 or 90 day supply of sertraline for, $3, $5, $6, $9. And they have my cell phone in case they have a breakdown or something concerning happening in regard to their depression. And then when we have more complicated patients with multiple chronic conditions, we have enough time to set aside an hour to really dive into what's your hemoglobin A1C, how's your blood pressure been, how's your back pain been, and really look at all the medications they're taking and making sure that they're on even keel, taking their meds, not having any side effects or contraindications, things like that to make sure people are healthy. And then taking it one step further, okay, let's see how we can bring your A1C down further. Let's talk about exercise. Let's spend 20 minutes just talking about your diet. Those are the tools that I have, and it's mostly time-based. I have just more time to dive into these conversations with people.
Right. And I also remember when I was with you that there was a patient who presented with a fractured, I think it was the distal phalanx of his thumb. And he was really concerned because he had some like basketball tournament coming up. So what you did was you wrote up a report on this website to a orthopedic surgeon who was on call, and then he gave you his his input, and then I think you had the whole thing resolved in just a couple of hours. And I thought that was amazing. Could you just talk a little bit about how that works and what that is?
Yeah, I saw that guy earlier that week, and he is a really busy restaurant owner, and he jammed his thumb playing basketball, and he thought it was a bad jam. I thought it might have been fractured, so I ordered the x-ray. He ended up getting it done that Friday at 2:00, and I had checked stat on it. So they read it right away. They read it as a fracture. I called the radiologist, confirmed with the radiologist, and then together we sat down. We quickly took those x-ray images from like our digital readout of that x-ray and put it into what's called Rubicon. It's that e-consult platform that you were mentioning. We sent that to an orthopedist, and they gave a recommendation. And they actually recommended that he require like a pinning surgery. But then we sent a text message to a hand surgeon specialist locally that I worked with previously, and he recommended splinting and follow-up with him, in the next week. So we made that appointment. After you had left over the weekend, I made that appointment with that other doctor. He got it done, and he was, encouraged to continue with the splint, and then after healing in 4 to 6 weeks, engaging in some higher intensity physical therapy. So like, as a physician, utilizing text messages, emails, e-consult platforms, and phone calls with the radiologist, we were able to give a comprehensive care plan to this guy where let's say you got a x-ray done at 2:00 on a Friday, like good luck getting into your PCP in the fee for service system. And then, good luck getting a specialist consult, like, that same day, or 2 specialist consults for that matter. So that was just like, that doesn't happen every day, but it happens probably once a month where we're, diving into these differing opinions on what to do with patients and trying to help patients navigate those difficult decisions.
Right. And I think one of the other things that made this really easy, and one of the other things that I think is fascinating about your office is how accessible, imaging and labs are for patients, and sort of the agreements that you have set up with different offices and labs in the area. Could you kind of just talk a little bit about how that works and what that is?
Yeah, for the guy with the thumb x-ray, he needed a hand x-ray, and that was $45 at Regional Medical Imaging. They're just down the street from us, and that x-ray might have been $150 or $200 at the hospital. And we have the benefit of having like an online portal and seeing the digital readout online, and having the radiologist's cell phone number that we can call them and discuss it. The other part of it is just like we can draw blood in our office, and we can run a comprehensive metabolic panel for $6, whereas a patient, if they went to the hospital, it might be $150 for that same CMP.
Right.
We have all those prices on our website if you want to check it out, plumhealthdpc.com, and then we have a little tab under our pricing page where it says, click here for our labs. But we're saving people like 50 to 90% on those labs, and the same thing for our meds. We get our meds at wholesale prices, and then we give them to our patients at cost. Just like I mentioned the sertraline earlier, sertraline 50 milligrams, I think it's 2.5 or 3 cents a pill. So our patients are paying, 90 cents a month or something like that for a 1 month supply, a couple dollars for 3 month supply.
Right. So one of the other things that I loved about your office was how easily it was for patients to get in for an appointment, and, they can call or text even, and you guys offer same-day appointments. So what I'm wondering is, do you reserve time slots each day for last-minute same-day appointments? And how quickly could a patient get in if they really needed to see you?
Sure. I mean, that happens every day. I typically have like 3 or 4 scheduled patients each day, and then I usually fill in with, 2 to 5 same-day appointments, depending on, you came in early January, so you saw a lot of like people sometimes even just walking in. Like our patient with the thumb issue, he got that x-ray at 2:00 and he just came right down. He did text me. He said, I got the thumb x-ray. They said it was broken. When can I see you? And I said, come right now. Take care of.
Yeah.
But a lot of folks are texting me each day and getting an appointment. So like yesterday, I had a little girl, 3-year-old girl, who her dad said that her eyes had some purulent discharge. They were erythematous. And he said, there was some pus and her eyes were red. He sent me a text at 1:30. I saw her at 3:00. That's typical. That's standard. That's every day. And we're really happy and proud to do that, because that's what differentiates us from any other doctor. Our patients really text me anytime, and I guarantee a same day or next day appointment. Let's say you text me at 4:00. Perhaps I could offer a 4:30 or 5 if you're lucky, but definitely like 8:30 or 9:00 the next morning, I could see you.
Right. So one of my, my greatest appeals for coming to visit you was just kind of learning about this innovative, healthcare delivery model. And I'm also very curious about the business aspect of it. So if it's okay with you, could I just ask some business management related questions?
Oh, for sure, man. Happy to answer them.
So, I mean, this one is, I'm sure it's a loaded question, but I'd really like to know just about the leap of faith that you took starting Plum Health fresh out of residency, and any challenges or setbacks that you might have faced in the process.
Yeah, I think it was more of like a leap of determination. I think, as a physician, when you graduate from residency, you're always going to have an opportunity to moonlight on the side. And, so for me, I worked in urgent care for 20 hours a week on the side. And that allowed me to have like a reasonable income and then 4 days a week where I could devote to building up Plum Health. So,
Right.
If you're willing to sacrifice, for me, I don't have like a country club membership. I live in a reasonable house. I drive like a Ford Fusion. I'm not living large here, but I am investing into my business. That's really important to me, that I'm investing in Plum Health so that I can have like a really sustainable practice that I enjoy working at each day. And that makes me happy when I come to work each day. So like part of my ethos is investing in my business and building a practice that aligns with my personal values of giving back and serving people in the community. So I knew that I could be successful in this model as long as I had some kind of side income for a year. And so I did that. I worked in urgent care for a year during my first year of starting my direct care practice. And then when I built up to, let's say, 150 members in my DPC practice, I could walk away from the urgent care work and focus full time on my direct care practice.
Sure.
So, part of that process was I took some small business courses. I wrote a business plan in my residency. If you're watching this, you want to learn how to write a business plan. If you want a copy of our original business plan and our current business plan, it's on one of our courses on this website, Startup DPC/Take Action. There's like a business plan course. You can take it. It takes about an hour or two to go through that course. I show you everything you need to have in your business plan. That's like mandatory. You have to write a business plan. That's a skill I didn't know how to do. There weren't a ton of great resources, so I wanted to put together a course to help the next doctors who want to do this. The next thing that I did is I took some small business courses that taught me about like branding, marketing, how to build out an office, etc. Again, I've tried to put some of those resources on my website, like how to build out an office, how to brand yourself, how to market yourself, all those things to help the next doctor who wants to start their DPC practice. So for me, when I graduated residency, I took 2 small business classes. Each were about 8 weeks, and they covered a whole bunch of different small business topics. And then on top of that, I read a ton of books. I read like 50 business books in my first year of practice. Authors like Gary Vaynerchuk, Crush It, Grant Cardone, The 10X Rule, If You're Not First, You're Last, Tony Robbins, Seth Godin, on and on and on. Just like a lot of different, virtual mentors in a way. You can kind of get a flavor for how they operate their business through their books.
Sure. Yeah. And so something you mentioned that for a DPC doctor, it's typical to have a patient panel of about 500. How was the process of building your patient panel, and how many patients did you need to break even, you could say?
Sure. Yeah, there's 2 different things there. And I talk about this in the business planning course, but there's like a break even on your operational expenses. And for me, when I first started, my overhead was about $5,000 a month. That was like rent, lease, EMR, malpractice insurance. The amount that I spent on meds and labs each month was about $5,000 on average in my first 1 year. So if you think about the number of patients, that's 100 patients. If you're making $50 per member per month, that gets about $5,000. You break even operationally. Then, when you want to start paying yourself, you're looking at getting to like 200 patients, because then you're making $5,000 for your overhead, $5,000 to pay yourself. And then incrementally, your overhead's going to increase with more and more patients, because you have to buy more meds, more supplies, maybe hire somebody, use additional services to make your business run more smoothly. And then your overhead's going to gradually increase over time. So a break-even point, depending on your price point, it depends a lot on your lease, the price of your lease, and the cost of your staff. Conservatively, might be around 100 patients, and then when you can start paying yourself, probably around 200 patients.
Right. Now, something that I foresee as a potential challenge is you are a doctor, you're a compassionate family doctor, at the same time you're a business owner.
Sure.
How do you balance your time between the two, and how do they How do those two aspects of your life kind of interact with each other?
Yeah, that's a great question. I think on one side of your brain, you're the doctor, where like you leave no stone unturned. Mistakes are frowned upon at best and punished at worst, right? If you make a mistake, you're going to hear about it from your attending, going to get chewed out or whatever. In the business side of thing, like mistakes are valued because it's a learning experience. You made a mistake, that's awesome. You're never going to make that mistake again, or you're going to do things differently in the future. It's a mechanism for learning. And the more mistakes you can in quick succession, you can, the more successful you can become. So like when I take care of my patients, I definitely have my doctor brain on, where I'm focused on the details and making sure that I hear everything in the history and come up with a comprehensive care plan. But when I'm working on my business, I'm turning on my business brain, where I'm making really quick decisions, trying to do things relatively quickly and not overthink things or hem or haw on things for too long, because when you wait too long, you're going to miss opportunities. So that's not something you're taught in medical school. You're just not. Yeah. And that's something you kind of have to learn through experience.
Right.
The other challenge is like, being the doctor and seeing patients, and then being a business person, collecting revenue, collecting money from your patients. And that
was my next question.
Yeah, that'd be super uncomfortable. Listen, I know I was just treating you for diabetic foot infection, but you also have an outstanding balance of $200 because this hospitalization set you back. And if you're honest with people, you just level with them. Like, listen, I'm your doctor, but I also have to make money too. Usually it works out fine as long as you communicate with people about what you need to do. And then as you grow, perhaps you delegate more of those tasks to your medical assistant, or you hire a billing company or something like that, if it really makes you uncomfortable. For me, I'm able to navigate that pretty easily. It's just kind of
right.
Hey, I'm delivering you a valuable service, and you have an outstanding balance of $50 or $100. Can we settle your balance, or do you need to close out your account? Do I need to write it off? I'm good with either. Just let me know.
Right.
And a lot of people respect that approach.
Right. And obviously everybody has different circumstances at the same time. However, obviously you're offering an extremely valuable service at an extremely affordable price. And, I think that just those circumstances allow for more honest conversations between people. And you also have more time to, maybe this is jumping back to some of the questions I had earlier, but the amount of time that you have with your patients also enables you to have those types of conversations about their personal life, about maybe stress, financial issues, other things that are going on. I noticed that when I was there, you do a lot of listening. You do a lot of listening, and they do a lot of talking. And not to say that you're not doing your job, but you could say it's therapeutic for them in a way, and it helps you to understand what they need and to help them more,
Yeah, totally. I mean, I think the majority of my job is just listening to people and hearing out their concerns fully, and then coming up with a plan to address those concerns. And a lot of time the therapy is just in having somebody that they can trust to tell those concerns about. I haven't told anybody about this, but I'm struggling with this. And just being a listening ear, not judging, and just, sometimes not saying anything and just listening, or tell me more about that, or I'm sorry to hear that. What can I do to help? And sometimes it's like, I don't know if you can, but I just wanted to tell you that. Or it might be they really open up about a concern, and it's like, it sounds like you're depressed. Let's do a depression screening. And there's a lot that goes into these appointments. And as a family doc, I'm grateful for this practice model because I actually have more time just to listen.
Right. How are we doing on time? I still got a few more questions for you, if that's all right.
Yeah, dude, let's do it, man. We got definitely a few more minutes.
All right. I did have one more business question, and that was
sure.
How malpractice works. Is it the same for you as it would be for another family doctor?
Yeah, I think it's essentially the same. I called up a few different malpractice carriers, and I asked them for good prices. One of the pieces of advice I give to doctors starting their DPC practices is get 3 quotes. Don't be lazy. Don't take the first quote. If you're building out a new office, or if you're getting a malpractice insurance, or if you're getting a website designer, or if you're hiring a photographer, look at 3 different quotes, compare and contrast, gather the information, then quickly make a decision and move on. For me, I got 3 quotes on malpractice insurance. One, sometimes it's a little bit lower because I'm seeing 1/5 of the patients of a typical family doctor, and I'm spending 5 times as much time with those patients. So my malpractice insurance should be a little bit lower. Just in full transparency, I pay about $450 a month. It's like $1450 a quarter for that malpractice insurance, which is pretty standard, about $6,000 a year. So it's not that different. The only difference is if you've always been employed by a hospital system, you probably never made that phone call.
Right.
So there's some terms you need to understand, like tail coverage and maximums and all this kind of stuff. But if you have a good agent, you can ask them to describe it to you. And then you call the next agency and you ask them to describe their coverage for you. And then you reach out to a mentor of yours, like a older family doc who's bought a few different insurance coverages, and say, what do I need to look out for? Where can I get burned in this?
Right. Okay. I have a few questions that are potentially sensitive, more personal about you, and kind of, the personal side of what you do, if that's all right.
Yeah, sure, man.
So I think something else that decentralizes people from going into primary care, especially family medicine, is compensation for the work that they're doing. And what I'd really like to understand is, and especially as a business owner, how would you say your income compares to that of maybe a family doctor in more of a traditional office setting?
Sure. I think that's a great question. I think every medical student would want to know that before choosing a DPC path. So, when I graduated, I was offered $165,000 plus a $10K signing bonus by the institution that I trained with. Pretty standard. When I was moonlighting in urgent care, I was making $70 an hour, seeing about 4 patients an hour, 3 to 4 patients an hour. So that was like, for reference, that's the kind of money I was offered, or what I was making moonlighting.
Sure.
You can get higher if you're in a rural, or it depends where you are. All these are regionally dependent. But for like Metro Detroit, it's pretty saturated with physicians, so you're not gonna get like a huge salary unless you're doing a huge volume. Like if you're seeing 40 patients a day, perhaps you could earn up to $400,000. But that's like exactly the opposite of what I want to be doing.
Right.
I want to be spending more time with my patients. So in the first year of my practice, I probably paid myself what a resident might make, $6,000-ish, $7,000 a month. And I've paid myself progressively more and more. This like last calendar year, I probably paid myself around 110,000. Now, I could have paid myself much more, but this last year I also spent $200,000 building out this beautiful office that I occupy now.
That's beautiful, man. Yeah.
Yeah. Thank you.
Awesome.
Yeah. And so part of this is, as a business owner, I think differently about money than an employee might think about money. So for the doctor that I hired, she has the opportunity to make $200,000 to $240,000 a year, whereas perhaps I would want to make less than that, so that I can keep reinvesting money into the business to grow a more sustainable practice for the future, for future growth. So like right now, I'm sacrificing my personal income for a long-term income potential in my business. And I think that's not the way doctors typically think. They are thinking, dude, I just sacrificed 11 years of undergrad, med school, residency, and now I just want to get paid.
I feel you.
But as a business owner, you're thinking differently. You're investing for the long term, and that's right. I'm kind of playing the long game. I could pay myself more, but it would come at the expense of I would grow more slowly in terms of my business, because I wouldn't have enough money to invest in marketing, or invest in hiring another doctor, or hiring another medical assistant, or building out an office, which helps us be sustainable for the long term.
Exactly. As a lot of people know. Did you want to say something else?
Yeah, the other thing is I'm intentionally working in a lower income community. And in terms of the spectrum of charging people money for DPC, I'm on the lower end. charging $10 a month for kids and $49 a month for adults as our starting rate. Whereas other doctors in the movement are charging on average, let's say $70 or $80 a month or $90 a month. So if the cool thing about this is don't let my salary dictate what you can earn. If you want to go out and make $500,000 a year in DPC, you could probably do it. You'd probably be bordering on like a concierge service. You'd probably be charging like $120 a month or something like that. But
Sure.
if you want to do that, it's your right. You have the autonomy. And so that's like the second part of the answer is like a lot of DPC doctors are making a little bit less than what they would have in the fee-for-service system, but they're more fulfilled. And then they might say nothing pays like autonomy, because you get to decide what to charge your patients, what you want to do for your patients, what kind of services you want to offer, the hours that you want to work. Yeah, if I worked 8 to 6 every day, I might be making more money, but I'm working 9 to 5 and I have a really good like work-life balance.
That actually leads perfectly into my next question. As people know, ranked professionals, as far as mental health and suicide rates go, doctors are actually up there. They're really up there. And one of the main contributors people are discussing is burnout. So I wanted to know, do you experience burnout, and how does working in DPC impact that?
Yeah, I definitely experienced burnout in my residency because I felt like I was doing a lot of meaningless work, which is ironic because a lot of those metrics are called like meaningful use, right? But I felt like I was spending more time checking boxes in the EMR than I was taking care of patients. And at the end of the day, none of that information I put in mattered in terms of giving our patients a better outcome in that fee-for-service system. It was more just to satisfy billing codes for insurance companies, which was crap. I didn't like that. In my model, I feel more fulfilled because I'm like in control of my time and I'm in control of where I direct my effort and energy. So it makes a huge difference in terms of my satisfaction. And I definitely feel a lot more satisfied in my work. Sometimes I feel overwhelmed. Like if it's like January and everybody's sick, they think they have the flu. I'm seeing like 10 or 12 patients a day. That's like a lot for me, especially in this model where you traditionally spend more time with people. But
Right.
those feelings of overwhelm are fleeting. I would say I take my worst day in DPC over my best day in the fee-for-service model.
That's great. And are you able to build personal time into your schedule? How's your work-life balance?
Sure. Like, today I carved out, an hour to do this with you. And then I actually met with a journalist for the hour before this meeting, just chatting with them about our model, how it works. And those are things that I care about. Sometimes I'll take an hour away or a half day away to spend some time with my family. And that's all right. My patients don't miss me. I just schedule everybody for the afternoon. Sometimes I'll, maybe every other week I'll take some time like that. I also teach at the medical school, which is really fulfilling for me. I do that, 2 hours, 2 times a month. Those things are energizing for me. So that's why I do them. And they help me with different levels of satisfaction. And then you were here when I was, I'm kind of wrapping up the last parts of this next book that I'm putting out. And it's like, that gives me a ton of satisfaction too, because a lot of people have these same questions. So I've been trying to put all my thoughts into a book, and that's coming out soon. And that's kind of like professionally satisfying for me. It's kind of scratches an itch that patient care doesn't necessarily scratch.
Yeah. My final question, and kind of the way I'd like to wrap up this call, if it's okay with you, is what advice could you give to medical students who are on the fence of going into a primary care field and maybe are hesitant because of pressure from other medical professionals who want them to specialize, or they're concerned about money or X, Y, and Z? Like, what would you tell them?
Yeah, I mean, I think what you did would be what I would tell them is like, if you're interested in this model, spend a day or 2 days with a direct primary care doctor, or set up some sort of elective rotation where you can spend some time with the DPC doc. It's going to be different. It's going to be very different from your fee-for-service experiences. And if you could see yourself doing what that doctor does, if you can have that like prototype conversation, and understand what their day-to-day is like. And if you could see yourself doing that for the long term, then pursue it. Don't let money stop you. There are higher paid specialties in medicine, but also, there are sacrifices that different specialists make to have those. If you want to be a surgeon, you're going to be doing surgery for long hours on your feet. If you're doing ophthalmology, sometimes that work can get tedious. It's a lot of punching over eyes and a lot of small scale surgeries. If you're all about that, do it. But if you want to do primary care, if you want to use a ton of different tools in your toolbox, if you want to use the full breadth of your training, direct primary care is a great way to go, because you can really be the doctor that you were meant to be. You can spend time with your patients. You can take care of a ton of different concerns. And for me, that's empowering. That's why I became a doctor in the first place.
Right. Thank you so much, Dr. Thomas, for answering all those questions. I really appreciate the work that you do. I had a great time shadowing you, and I have a lot of respect for what you're doing. And I'm looking forward to staying connected with you throughout my journey.
Yeah, man. Come back to the office anytime. Next time you're in Detroit, stop in. We'll see some more patients together.
Will do, man. Thank you so much.
All right. Take care, John. Have a great one.
You too. Bye-bye.
See ya. Hey, everybody. Thanks so much for watching this episode of Startup DPC. If you really enjoyed the show, leave us a like here on YouTube. Leave a comment. Share this on your feed. Share this with some other doctors who might be interested in this practice model. And if you want to take your game to the next level, if you want to really grow your DPC practice and turn it into the best thing possible, take one of our courses, startupdpc.com/take-action, and you can really immerse yourself in the next level, growing your practice, serving more patients, and taking your practice to the next level. Thanks so much for watching, and have a great day.